Hi, this is Dr. Van Yee from the Center for Aesthetics and Surgery. Welcome back to our What You Should Know series. We're talking about rhinoplasty. Last time we talked about why do people seek a rhinoplasty, or who's a good candidate for rhinoplasty. We talked about the aesthetics or the shape and appearance of the nose versus the function of the nose. How easily do I breathe, and does that need to be modified? The other thing we need to talk about is what actually happens during a rhinoplasty. How is it done? Well, there's a lot of different ways to do a rhinoplasty, and if it's combined with the breathing component, the septoplasty part of it, it adds a little bit of complexity. Basically, there's two ways that most surgeons would approach a rhinoplasty. You may have heard the term open versus closed, or endonasal, which is closed, versus an open technique. What are the differences? Well, it really has to do with the incisions. An endorhinoplasty, or a closed rhinoplasty, there's no external incisions. All the incisions, all the work is done from inside the nostrils. So there's nothing on the outside. That adds a level of complexity and probably a little less accuracy. Maybe that's the best term, especially when you're dealing with the cartilage that forms the tip of the nose. Most plastic surgeons in this country, especially if we're dealing with the tip of the nose and the complex cartilage that involves the tip, we'll do an open approach. So what's the open approach? Where are these incisions? Well, they're still mostly inside the nostril, but they connect across this part of the nose right here. We call that the columella, and then it includes an incision inside each nostril. Well, why is that important? Well, it adds a significant amount of exposure. The surgeon, when we make an open rhinoplasty incision, is able to peel all the skin, fatty tissue, off of the framework of the nose. That's the bone and cartilage. We can peel everything up and have it all exposed. It's like taking the rain fly off of your tent. You've got the tent poles exposed there. Then you can easily see the poles. You can modify them to the shape that you want, drape the skin back down just like you'd throw the rain fly back on your tent, and you can see the shape. And if you're not satisfied yet, you can pull the skin back off and remanipulate the cartilage. And sometimes it can take different techniques, whether it's suturing techniques, cartilage grafting techniques. Maybe you need to do a little bit more, a little bit less, and then you can continue to redrape the skin, step back and see if you've achieved what you're hoping for or what the patient is desiring. That's the advantage of the open. The disadvantage is you have about 5 millimeters of an incision on the outside of your nose. The reality of that is, in 22 years of practice, I've never had somebody complain about that. They tend to heal beautifully if they're designed correctly. Very, very inconspicuous, not a part of the space that's paid attention to you, I guess, when you're talking to other people. So it's just inconsequential, but the added benefit to the surgeon, especially for dealing with the cartilage here at the tip, can be significant. So that's the difference between an endo or an open versus a closed technique. Hope that answers your question about that issue about rhinoplasty. Come on in and talk with us.